So we're now going to have a look at getting a patient up off the floor using equipment. When using any equipment, it's very important that you are aware of the safe working loads of the equipment. So the Mangar ELK, which is what we're going to use now, is 70 stone safe working load. There may be a risk assessment, a formal risk assessment for this patient that you need to read, but you'd still be carrying out your dynamic risk assessment. We have assessed that this patient is not injured, and we have tried prompting them to get up off the floor, which they're unable to do. So hence we're thinking about using equipment. So what we're going to do first of all is we're going to have a little think about how many people we need to assist with this. So we're going to have one of us on either side, potentially one at the head end, and potentially another member of staff at the foot end. Or you might only need one at the head or one at the feet. It all depends on the ability of the patient and what they need assistance with. So what I'm going to do with the patient is get them to roll towards my colleague. So if you can put that hand across, bend the knee, looking in that direction and having a roll. Then with the cushion part of the Mangar ELK, I'm just going to remove the piping for the moment. And the Mangar ELK cushion needs to be this way up with the patient sitting on it. So I'm just going to fold about a third of the front in place like so. I'm then going to push it in towards the patient with the top end of it roughly in line with the waist belt. I push it in as much as I possibly can, and then assist the patient to roll back onto their back. Now my colleague the other side is just going to pull the other part out. You might need to do a little bit of an extra roll, but you might not need to. So from here, myself and my colleague are going to get into our floor fab stance onto one knee. As I said earlier, you might have one member of staff there assisting on the head, and maybe one member of staff there just keeping those feet nice and still so the patient doesn't slide. So from here, we've got the inside hand on the shoulder and the outside hand on the back of the arm, and we're going to sit up on the word sit. So ready, steady, sit. So bringing them up into position like so, and then from there you might get them to bend their knees a little bit. And I've got some assistance from my colleague, but you could also use a chair on either side for the patient to put their hands on as well. So from here I'm going to start attaching the pipes. So it's nice and easy, they're all colour and number coordinated. So I'm just going to put each pipe on. And you can hear a little click as they click into place. We then attach the other end into the pump, like so, it just clips into place. We're then going to turn it on, and at this point I'm going to press each button one at a time, starting with 1, 2, then 3, then 4, inflating each one of the cushions within the Mangar ELK. So we'll start at the bottom. So we're going to start with number 1. Like I said, you can have a chair on either side if needed for the patient to hold their hands on. So it's going to make a bit of a noise, so you need to warm the patient first. We're going to start with number 1. Automatically stops when it was full. And you may have noticed the patient sort of feeling a little bit wobbly as it started inflated, which is perfectly normal. So I'm just having a little look at the feet. I don't know whether we can bend the legs a bit more, just a little bit more. And then number 2. Number 3, bending a little bit more if we can. Really good. of our patients, you might only need to inflate 3 cells, depends on their height. With this particular patient, we'll go up a little bit further. Can you bend your feet a little bit more? That's good. Careful here because the heels are starting to come up. So can you just shuffle forwards a little bit onto the edge of the seat? Just do a little bottom shuffle. That's it. So you just need to be a little bit careful with that. If it starts to bring the patient's feet up off the floor, then we may need to bring them towards the edge of the seat. Okay, so going from there, then if the patient can stand up and transfer onto the other seat. And adding on to this, I just want to emphasise how to deflate this. So from this position here, the first thing you need to do is take this pipe off. And then you need to deflate each cell a little bit, just to take the pressure off each cell. Doesn't really matter which order you do it in, any order. The reason I'm doing this is because if I don't take the pressure out, when I take these pipes off, it's quite a loud noise, which is quite frightening. When I feel there's enough pressure that's taken out, I then take each one out.